So how can neurotechnology help for women going through perimenopause and menopause? Perimenopause refers to the years before menopause, which is formally when you spend a year without periods, and can manifest with a wide range of symptoms. Brain fog is the most common one, but a lot of women will notice symptoms like low mood, anxiety, irritability, in some ways quite similar to premenstrual syndrome or PMS that they might have experienced before, but lasting for a much longer time and often much less predictable when you hit perimenopause. It's worth noting that perimenopause now starts as early as 35 years old and obviously varies quite a bit from woman to woman, but it's usually characterized when essentially initially your progesterone levels drop, and they tend to drop quite consistently from the onset of perimenopause. And over this perimenopausal period, as well as in the beginning of menopause, your estrogen will continue dropping. But unlike progesterone, that tends to decrease very linearly and therefore be generally quite well tolerated by the brain, estrogen tends to decrease in a very chaotic way. In the 10 years before menopause, if you, let's say, have perimenopause for 10 years, your estrogen levels might suddenly dip one cycle and then suddenly go off the charts again. Even though the trend line is down, you will experience this instability in estrogen. This means that some days you might feel incredible brain fog, the complete inability to focus. Other days you might feel totally fine. Another day you might feel insomnia. That's a wide range of symptoms, but when we hear all of those symptoms as neuroscientists, we know right away that their cause is exactly in the brain, because even though there are all of those hormonal changes, it's the way the brain responds to those hormones that leads to feeling that you can't modulate your stress response or you can't modulate your emotional response. By stimulating the dorsolateral prefrontal cortex, which is the part of the brain engaged with nervous networks responsible for your perception of yourself, for your regulation of your emotion and decision making, we're able to restore symptoms that otherwise would manifest as brain fog, fatigue, irritability, inability to control emotions. And by modulating the pain perception through the motor cortex, we're able to modulate the potential pain symptoms associated with migraines that a lot of women experience around their perimenopausal phases as well. Every woman will respond differently to this perimenopausal transition, as well as to the treatment with brain stimulation. However, we know that neurostimulation over time will lead to a more smooth progress through these stages and will allow you to thrive during this perimenopausal stage that can honestly be very disorienting for many women who did not expect this to come.